I would like to start by talking you through the Alma IQ consultation flow, which is really how we see the Alma IQ being used in clinics as a tool for consultation, for patient engagement, and to really thoroughly analyze the skin and come up with a personalized treatment plan for patients. And this treatment plan involves energy-based devices, skincare, injectables, and really all the modalities we offer today in the aesthetic realm. So how do we do the consultation flow? It's basically 4 steps. So of course we need to capture the images. We need to take the photos first, and we need to take them in a standardized way so that we have high quality images, of course, to analyze the skin and also to compare in before and after images and track treatment progress. We want to analyze the skin, and we do this using 3 modes, which I'll talk about today, that are on the Alma IQ. We then do what is unique in the Alma IQ as a skin analysis system, and this is that we have the skin concerns in the system and a built-in decision tree to help clinicians decide which energy-based system of Alma is the most appropriate treatment for their patient. And finally, we have the report, which is a very comprehensive report which can be sent to the patient with pricing, with a full comprehensive treatment plan. So once we get to this part, we're going to switch onto the iPad and go through the report on the iPad as you would in clinic. So starting by capturing our images. So regarding patient preparation, ideally the patient will come to the clinic without wearing a lot of heavy makeup, and then in this way they can clean their skin with micellar water. This is the best product to prepare the skin for the imaging. We then want to remove any jewelry, earrings, necklaces, and very importantly, we have to use the black headband and cape that's provided with the system to block out any light. So I can show you an example of if a white t-shirt or a white headband is worn instead of a black, it will make some of the filters completely ineffective because it's just going to absorb all the light. So the black headband and black cape for facial capture. And then if we want to capture décolleté or neck, we obviously want to clean and prepare the area as per the face. And we have a special comfort wrap, which is like a towel that comes with the system with elastic, which they can use to ensure that they're modest. So as David mentioned, it's a mobile stand. It can be moved from room to room in the clinic, or it can be positioned in one place and the iPad can be taken to be used in the consultation. Here we have the mobile stand, and we can see we have the patient standing, and she's standing very comfortably in front of the Alma IQ, and she's placed her head inside the barrel for image capture. Inside the Alma IQ, we have a chin rest, and this chin rest can be moved to 3 different positions and has a little toggle on it where we can change the angles of image capture. So we can capture up to 5 different angles, either the central 0 degree, right and left at 40 degree, or right and left at 90 degrees. So this is a very comprehensive visualization of the face. And we can see here that we have the hood on the barrel. The barrel is the black circular part, and we have this hood, which we call the light shade. So this light shade needs to be secured behind the patient's head and under their chin, again, to block out any light, and this will give us the best images. As you can see, what can be seen from the clinician point of view, we can see the patient's head nicely centered. We can see the 3 vertical lines are centered perfectly in her centered face, and this is how we are going to capture our images. The other thing we have, which is very useful for the patient, is called the FPS, or the facial positioning system. And this is a small bar that we can see on the iPad, and also the patient can see inside the barrel to ensure that their head is positioned on the right vertical angle, so it's not too high and not too low. So there's basically 3 lines that need to be all joined as one straight line. So this middle line will be either up or down if the patient's head is not on the right centered angle. So this is very useful, and we can see this also in the right and left the right and left sides of the barrel. You also have this facial positioning system. This is just a short video of me preparing a patient for Alma IQ image capture, and I'd just like to take this opportunity to mention we have very, very good training videos for the Alma IQ involving installation, setting up the app, setting up the catalog, and of course capturing and analyzing the images. So we can see that we can adjust the height of the Alma IQ to suit every patient's height, so that she can comfortably place her head on the chin rest inside the barrel. There you can see the facial positioning system that's flashing. It needs to be all in one line. Now I'm just opening up the light shade and securing the magnets underneath her face, so blocking out all of the light. This is the app that you'll have installed on your iPad. And here we can see her face in the system, and she's moving her head up and down until we have the facial positioning system perfectly aligned. Now I'm capturing centered images. So as you can see, there's a white circle around CO. So we're capturing the center position. And after these images have been captured, it will then prompt me to capture the right side at the 40 degrees. So I just simply need to swivel the chin rest and toggle or twist the chin rest until you can see 40, and you'll be able to see that when you're standing on the side. You'll be able to see that the 40 is there, so we know we're on the right angle. This is for 90-degree capture, less used on a day-to-day basis. I would say it's only really necessary if the patient has some sort of indication really on the side of their face that you need to capture. Generally, the center and the right 40 and left 40 is sufficient. I'll talk a little bit later about the selecting the skin concerns and going through this flow for the EBD recommendation. But for now, that is image capture, and here's just a little bit of a video of all those images being captured. So the really nice thing with the Alma IQ compared to other cameras or medical grade cameras is that we have the ability to capture images of the neck, the décolleté, the torso, the back, and really anything you want that you can put inside the Alma IQ, whether it be an arm with terrible pigmentation that you plan on treating with an energy-based device. So this is a very, very nice addition. When we want to take images of the patient's chest or neck or back, we need to change the light shade to what we call the extended light shade. And this comes with every system, and you'll see it's just the bigger one that comes down and covers the top of the back as well. For these images, we need to remove the chin rest, and when we're taking images of the décolleté, so just the front of the chest, we have what we call the décolleté rest. And you can see here in this image, it just sits at the bottom of the sternum and just maintains the correct distance of the patient from the camera for good imaging. So here you can see a back image that's been taken. Here we have 90-degree of the neck. The neck capture is obviously going to be excellent for analyzing the jawline, also very good if we're doing any filler treatments to the jawline. And this is just an example of, how important it is to capture the décolleté, for example. We have a lot of sun damage and pigmentation in many patients which would like to have this treated. And just like the face, we're able to capture the images, analyze the depth of the pigment, choose the most suitable treatment for this patient, and then, of course, to follow up with after photos. And the back. This is just an image of the neck and the jawline on the 40-degree angle. And now I'm just going to mention ghosting. So ghosting is a very useful additional mode that you can either switch on or off. There's a little button here that basically has a green line. This is only when a patient has had images already saved in the Alma IQ and they come for follow-up. So we want to make sure that their face is in exactly the same position as it was the first time. Because we know if we have a patient with a before and after photo, and the after photo, maybe they have their eyes open or maybe their head's on a bit of a different angle, it's really going to take the attention away from what we're actually trying to look for, which is the result or a change in the skin quality, pigment, vascular, or whatever. So this is very nice to make those standardized images in follow-up appointments. So to summarize, when we capture images for light modes, which I'm going to talk next about the 3 light modes, for light modes, we want to capture the center and the minimum, the 40-degree angles of the side. When we're assessing facial expression or facial harmony, we need only to have those center images taken. So now coming to analyze the skin, and we can do this in 3 light modes. So the first is light modes, and to keep it really simple, light modes is really going to give you information to select EBD treatment, so laser, radio frequency, etc. Facial expression is going to guide neurotoxin injection, so for example, Botox. Facial harmony is going to guide generally filler treatments. So now I'm going to go through each of those modes in more detail, but just beginning with a bit of buttonology. So this is what you'll see on the iPad screen once you've captured the images. You can see here on the bottom, we've captured all angles. We've captured the center and both angles on the right and left. So here we have the light mode. So all of these little buttons will change the image that you see on the light pad to texture, pigmentation, and all of these modes as listed here. The 360 illumination modes are just there on top. I'll talk about those also shortly. Facial harmony, as I mentioned, for the guiding of filler treatments, the positioning of the face, and face expressions. So that's just a basic run through of the screen. So now we'll go through all of the light modes and how and when to use them. So light modes are really for assessing, aesthetic and dermatological indications on the skin. And the 360 is more to evaluate volume, wrinkles, laxity, and the structure of the skin. So when we use these light modes to analyze the skin, obviously we're going to be able to provide a personalized and tailored treatment to suit exactly this patient's skin. So we start off by looking below the surface with these 3 modes: texture, pigmentation, and redness. So texture is excellent for looking at pores and rough and bumpy skin. This is not my go-to for analyzing these conditions. I'll talk shortly about really the most suitable modes. This can be used to basically support a decision you've made on the skin using parallel polarized, which I'll talk about shortly. So I'm not going to talk about this one too much for skin analysis. Pigmentation is an excellent light mode for analyzing the melanin distribution of the skin. So we all have melanin in our skin, and obviously people that have a lot more melanin will look very different under this light mode. This light mode is less suitable for very dark skin types, such as skin type 6. But this really enables us to review the skin tone, any discoloration, solar lentigos, or PIH. When we want to analyze pigmentation, we have a better mode, which is called True UV. However, this is excellent for tracking progress. Like, the results are very wow when you see a patient's before photo, treat them with a few treatments of Alma Harmony Clear Lift and DiBL, for example, and you will have a wow result on this image. Redness is an excellent light mode for analyzing the vascularity of the skin, whether it be local or globalized vascularity, inflammation of the skin, and redness. This really is an excellent mode for analyzing and, of course, for reviewing your results. Now we look at the surface of the skin using these 3 modes. So we have daylight, as David mentioned. This is standard light mode. This is what the patient sees when they look in the mirror every day. And it's a very important light mode to have alongside one of the filters, because you can say to the patient, this is what you see when you look in the mirror every day, but this is what we can see going on at the next level of your skin as we look a bit more deeply. Parallel polarized is excellent for reviewing skin texture. So this is what I mentioned before. Texture is a nice to have, but when we really want to analyze the skin's texture, and I'm talking about pores, lines, wrinkles, and dry skin, parallel polarized is excellent to review and analyze these indications. Cross-polarized, here we take the surface reflection off the skin and we can just see a little bit more deeply into the skin. This is very, very nice for analyzing pigmentation and vascular conditions, but more importantly, it's excellent for deciding whether an indication is more vascular in nature or more pigmented in nature. It's not always so clear, so this really gives us that extra information to make those decisions. A good example is a vascular melasma. Will show up very nicely here as more of a red than a brown, and we'll be able to give you that information to diagnose correctly. The final two light modes are really we're putting a wavelength onto the skin here in a very safe amount of energy to analyze the skin. So Woods is basically a purple wavelength, and this is the go-to mode for oily skin or for acne skin. And I'll show you an example after this where we have a patient with severe acne, and really their face will light up like a Christmas tree. And the reason for that is they will have all of these small dots that are orange. This indicates P. acnes bacteria, and these small dots will indicate oily sebaceous gland. So someone that has a very oily T-zone or has a lot of acne will have a bright, like lots of bright colors on their face, which shows they have a lot of activity in their sebaceous glands. True UV is the go-to for pigmentation analysis. So I mentioned the pigmentation, it's showing melanin distribution. It's great for tracking progress. But if we have a patient come in with pigmentation, we want to evaluate whether it's more deep or more superficial, we can get a lot more information using the True UV for pigmentation. Finally, I want to talk about the 360 illumination light modes. As you can see, there's a little toggle here that you'll see in the corner of the screen, and this allows you to move the light around to highlight different areas of the face. So we have it in either color, like it's called 360 light, or we have it in 360 gray. So this we can really show volume loss, texture, wrinkles, and even areas of scarring. And by using the gray mode, we can really highlight areas of laxity and deep wrinkles. And you can see here at the end, when I'm holding the light onto like that nasolabial fold, you can see how profound it looks when we change the shadows on the face. So now we have the facial expressions mode. So I mentioned this is for guiding neurotoxin treatment. So we know that facial expressions are something that we all make every day, and over time, aka with age, we're going to have more lines, and this is due to the muscles and the ligaments in our face, allowing us to make these different facial expressions. So with time and wear and tear, they can become deep, and then people want to have them treated, for example, with neurotoxin. So the facial expressions mode has 6 facial expressions, which I'll flick through now. And obviously, when we make different facial expressions, we're going to highlight different areas or different, like the glabella, the forehead, or perioral wrinkles, etc. It's important to point out here that when a patient has a treatment with a neurotoxin and they're laying on the treatment bed, the doctor will ask them to make these facial expressions to guide where to place the neurotoxin. So this isn't taking away from that. What this is doing is showing the patient the effectiveness of the treatment. So it's very quick to take these facial expressions as part of the consultation process. And then when the patient comes back a month later, they can obviously see the difference in the movement of the muscles of their face and the lines that they're able to create. So facial harmony is the final mode, and it's really for guiding treatment with fillers, And in this way, we can really analyze the symmetry of the face, areas of sagging that happen with age. And we do this by assessing 3 different angles. So we have thirds of the face. We're dividing the face into horizontal thirds to highlight and to focus our attention on different areas of the face. So we have the upper third where we obviously have the glabella lines, the forehead and the brows. In the mid face, we have the eyes, the nose, the temples. And in the lower third, we have the lips, jowling, and a lot of, lower face laxity and sagging that happens with age. And here, this is a nice way. Here we can see the percentage of the face, which is probably less relevant here. But we can also use the other function to just zone in on one of these thirds to, really focus the patient's attention to that area which you would like to treat. Fifths of the face, so important to mention here that during image capture, the patient's face needs to be perfectly centered to get this symmetry right. And we're all asymmetrical, which is great. We shouldn't, be symmetrical, but some patients will have a more profound asymmetry, which they're, quite unhappy with. So here we have the percentages. We can see that one side of the face is bigger than the other side, which again is normal. But here we have basically the center of the face, which is the nose and part of the lips. Then we have the inner fist, which shows jowls, eyebrows, and cheeks. And then we have the outer fist, which shows the temples and the side of the face. The final way to use this is during halves, is called halves, and it's not the most useful probably for guiding treatments, but it's definitely a bit of fun. And this is just to say to the patient, which is your favorite side, which is your selfie side. So if they say my selfie side is the right side of my face, you can show the patient what they would look like if both sides of their face were the right or both sides of the face were the left. And so generally one part will be more thin and one part will be more full. So now I'm going to talk about the viewing features. So we've captured our images. Obviously, when it's a first consultation, we won't have the ability to look at after images, but we will be able to view all of the different light modes and facial harmony. So we have view mode, which is just for that. And then we have compare mode, which is where we can look at our before and after images in multiple different ways to highlight the improvement after treatments. Facial angles, so we've captured those different angles. We can show the angles in different light modes to highlight, areas where maybe they have more pigmentation on the side of the face and show the patient, this is what you look like in daylight mode. But, in the pigmentation filter, this is what we can see. Expert mode is excellent for analyzing daylight against 2 different light modes. So I mentioned before, and this is a good example for pigmentation, where we have pigmentation on true UV, which is excellent for analyzing pigmentation. We then have the pigmentation filter and we have the daylight. So we can use this to show the patient the different levels of pigmentation and compare what they look like and what they see to what's really going on in their skin. Before and after, so this is a little video here that we can select the dates, so the treatment dates, from the initial treatment maybe to the final treatment. We can have them one on top of the other, called top-bottom, or side to side, which is more useful. Using our finger on the iPad, we can zoom in or zoom out. We can use what we call vertical, which is like a slider. And when the patient has had, treatments for redness or pigmentation, we can really slide and show the difference between the results before and after. So now skin concerns, and this is quite unique in the market, that Alma IQ has the ability to recommend Alma EBDs and applicators based on skin concerns. So first of all, to come up with these skin concerns and to really analyze them properly, we need to use the correct light mode. So this table is just showing you the best light modes for those skin concerns. So we start off by selecting a skin concern. So this may be that the patient came in with facial redness. That was why they came to your clinic today. So we will choose vascularity from the list of skin concerns. We will then grade the skin concern from mild to moderate to severe based on our analysis using our light modes. And then we ask the patient about the preferred social downtime, whether they want to go back to work straight away or whether they're happy to be at home with some downtime for a couple of days. So based on these data inputs, the Alma IQ will recommend an Alma energy-based device, an applicator. Now, this is based on regulated indications and evidence-based treatments that is the best thing to treat these indications from our portfolio. So it's very, very nice, especially if, say, in a clinic, they have multiple Alma devices, and sometimes it's hard to choose which is the most suitable for this patient. So if they have Alma Hybrid or Alma Harmony, and they think that Alma Hybrid is the best, that's what will be recommended. As you can see here, for redness, we have recommended the Clear Vas applicator on the Alma Harmony. We can also mark on the patient's face, just using the finger on the iPad, the specific areas of concern. So that's all from me. I now want to just change over to the iPad to go through a quick case study. So I'm going to turn off my camera and share that screen. Okay, so this is the Alma IQ screen that we will have on the iPad connected to our Alma IQ. David is going to walk you through the report and the catalog in a moment, but I just want to search a patient I have and just do a little case study on someone that I like to use. So this is Victoria, and this is the screen that will look like if she's had multiple sessions. So I'm going to go on to her sessions. We can see that she's had 4 skin analysis done at our clinic. And I'm going to start off with the initial consultation. This patient has acne. This is the report, which David will go through shortly. But to get into the back into the analysis screen, I just will click on her photo. So this is a patient in daylight mode. So she has acne, but when we look at this photo from the center position, she doesn't look like she has that bad acne, okay? But when we change to use the right and left angles, we can see how important it is to capture these angles as well, so that we can really see that she has acne in the temple and on her cheek. So navigating through all of the different light modes here, I want to show you what I found the most interesting for this patient, and this is the vascular light mode. So we can see with her acne, she has a lot of inflammation, she has PIE, and this is all really highlighted using this light mode. The other one I want to show you is the woods. So I mentioned woods being great for acne. So you can see she has lit up like a Christmas tree, and I'm zooming in here to show the yellow dots being the lipid sebaceous glands, very, very oily. And then we have the orange dots, which are the P. acnes bacteria. So all very, very active here. Going back to the center, I can go onto the daylight, which is like my standard, and I just want to show you the 360. Might actually show it on the side. Where here we can really use this toggle and really focus in on certain areas to show the patient parts of their skin which they may not have noticed before. So I now want to go and look at her treatment progress, because as we saw, she's had multiple treatments. So I'm going to go into before and after. And I want to go side by side because I find that the most useful. And we can see here that we have one treatment being at the beginning of October and this one being in November. So I'm going to change this to be a bit more of a recent treatment from all of her dates that we could see before. This is a really good way to point out two things. The treatment, the photo she had there, she wore a white t-shirt. And when we go into the UV and woods, you'll see how that really impacted the light, the photo quality. And the earrings have not been removed, and this also takes away. You can also see that her headband wasn't placed on properly. She has her hair popping out. But basically, I want to show here the difference between the before and after, that she's had a reduction in the amount of P. acnes and oiliness of her skin post the treatment. Now I'm going to switch on to this, and here you can see how much the light has absorbed by her white t-shirt and taken away from our image. So this is really too bad, you know, that we took these after photos. We want to show the patient, but we can't actually show her very nice quality images because we didn't standardize the image capture process. Here I want to show the redness. So this is before on the right-hand side. I know it's a bit back to front than the way we normally have it, but you can see here that we can show the patient the scarring and the PIE that she had at the beginning of the treatment program and the improvement that we can see. We can obviously see it in daylight, but when we show her using the redness filter and zoom in on those areas, we can really highlight to the patient the tracking of the progress. Now I would like to show you the slider. Again, too bad she has her eye open and closed. But we can see here how significant the change is. And I can put this also on the angle. You can say, this is what you were like before, and look at the improvement we've had. So this is a really, really nice way. And again, to include the patient in the consultation, to include the patient in the follow-up. And, you know, the iPad is an essential part of that process. You really need to take the iPad off the IQ and sit with the patient and show them their own skin. And this will be a game changer for the consultation progress.